vision. That vision started, that was a watershed line. I was forced to go to Delhi in front of all the secretaries and principal secretaries, health of all states, congregated at Delhi. There was a meeting under the health ministry, and that meeting was held to grant fund for Center of Excellence for Mental Health Care in 2010. Actually, nobody was ready to go, so I was one of the junior most officer, medical officer, grade 1. I had to go and face with all the leaders in mental health care. Director of IVAS was there, director of NIMANS was there. I was there among the junior most. But one thing I noticed, they understood my so-called newness in facing this type of august audience. They told me, please don't get scared. You just present your slide. So that day I presented my slide. I was asking for 100 crores rupees for Uttarakhand. They asked me, how long have you been working in this mental health? I said, for last 2 years only. So you think your mental hospital needs 100 crores? For, sir, I told that, sir, because I've been told that we should get fund for making it Center of Excellence. He told that first make the basic things at the mental hospital. Then ask for 100 crores. Then earlier it was 100 crores, but last 2 years, 3 years back I met, it was reduced to about 39 or 40 crores maximum. Now, okay, my slide is there. My subject today is mental health care and well-being, equitable distribution through the primary healthcare system leveraging AI and emerging technologies. That is my topic. Now coming to the mental health care scenario, 150 billions means 15 crores people need in India, 15 out of 140 crore, 15 crores people in India needs mental health care, yet only 30 million receive it, means about 3 crores receive it. AB survey, that was a survey in 2016. Now the survey, the latest survey is going on in Uttarakhand also, in 28 states of India, and I am the coordinator of that survey. And this report will come out within next 4 to 6 months. And just see, data, very interesting and it needs much of attention. Suicide is the leading cause of death in 15 to 39 years age group, surpassing road accidents and infectious diseases. So what does this mean? This means that we are losing our demographic dividend if we don't take care of the mental health care of the youth of this country. Next slide. And another thing I want to point out, the economic burden of untreated mental disorders in India is projected to be 1.03 trillion. This is World Economic Forum 2021. Just imagine. About $1 trillion. Just imagine the humongous amount of money that is costing. Now, our government of India has enacted this Mental Health Care Act 2017, and this is a very forward-looking, very progressive act. And on the basis of this act, our state, with the help of the expert committee members, in which I was also a member, we developed these rules and regulations regarding the mental health establishments, which includes de-addiction centers also. So, what is the preamble of the act? What is the main mandate of the act? That is, this act is right to assess mental health care. It is now right-based, like right to information, right to education. This mental health care in India is now, it is a right for the citizen of every citizen of India to get the mental health care. It is the government's duty to provide the services, or at least governments should arrange, should facilitate that he or she or anybody can get the services either from the private sector or from the government sector as the person wishes. But that facilitation should be done at the government level. So there is a great responsibility for us to facilitate the system, to make the system not only resilient, but smooth enough so that the delivery of mental health care can be given at a very efficient, can be given efficiently and effectively. There are certain regulatory bodies also attached with mental health care, that is MHRBs. Okay, next slide. What is the storyline of Uttarakhand? Uttarakhand has one of the highest population populations with limited access to mental health facilities. And one of the things I want to highlight is there is dearth of specialists and mental health professionals. About 50 or 60 psychiatrists are currently practicing in Uttarakhand, serving a population of over 1 crore. Just imagine. Is it possible? It is a thing we should mull over, we should contemplate. It is really affecting the economy, crime rates, and state's overall development. Especially in case of Uttarakhand. In the hilly terrain of Uttarakhand, the topography there is such that there are a lot of migrations. Young people are moving here in the cities, but their parents, their old parents, they are staying there. So I have seen in the hills, in the mountains of Uttarakhand, that those aged people, the geriatric patients, there are a lot of load of geriatric cases for this need for mental health care. I have given some bottom line and possibilities. I'm going to the possibilities. Emerging technologies, including AI, can revolutionize the mental health care landscape in Devbhoomi. That is possible. Because this is one of my research topic also. For the last 1.5 years, I'm working in my thesis topic related with AI and implementation of Mental Health Care Act. So one of the sayings by Mr. Bill Gates was, the advance of technology is based on making it fit in so that you don't really even notice it. So it is part of everyday life. Now, what is the treatment? What is the panacea? Leveraging AI and emerging technologies for mental health care in Uttarakhand. AI-based mental health screening and diagnosis. Actually, SMH is already working on the application of developing this for mental health care. We are developing this application of like Manhit from Madhya Pradesh. Ours may be named as Man Sambad. It is AI augmented. We are working with ITDA and also taking technical support from IIT Roorkee. And the mandate has been given by government of our state in the last month, January. And that project has come through Government of India last year. AI-based mental health screening and diagnosis, how it works. AI-powered voice analysis can detect depression based on speech tones and patterns and all those things. I think you all know it, because while we are using mobile, now the mobile has been integrated knowingly or unknowingly by this facility of AI itself. Now, telepsychiatry and AI-enabled mental health applications. There is a lot of scope for telepsychiatry, because psychiatry as such, it doesn't need to palpate the abdomen or auscultate the heart. It needs a patient hearing. It needs to understand the gestures, postures, gait, the facial expressions of a person. That everything counts to make a diagnosis of a psychiatric diagnosis. Now, number 3, AI-powered wearables and IoT for mental health monitoring. This is important, because to optimize the treatment, we can make these things, we can use these things. Virtual reality and augmented reality for therapy. AI and emerging technologies enhancing the operational efficiency of regulatory authorities in mental health care. Actually, this is because I'm facing the problems. I'm in SMHA, State Mental Health Authority. So we have given the responsibility of implementing the act. And act has certain bodies like MHRBs, which are quasi-judicial, which has quasi-judicial power, and lot of things are legal things that is related to this act and implementation of the aspect of the act. So in that case, for all paperwork and others, AI can help us a lot. By adopting AI and emerging technology, Uttarakhand can set a model for mental health care governance in India, ensuring that the Mental Health Care Act 2017 is effectively implemented. I should not go into much of the details. Next slide. Investment and policy recommendations for Uttarakhand. There are scope for investment in Uttarakhand in the arena of AI and emerging technologies. So I think if there is a private sector persons here, they will understand, or they will get the message that there's a lot of scope. Because I've been working in this emerging technologies for the last more than 1.5 years, and I found there are a lot of scopes because my vision sees those scopes to get materialized or realized. To conclude, why Uttarakhand should not only lead India in AI-augmented mental health care, but also create the ecosystem for R&D of foundational AI models. Actually, in India, we don't much talk about the foundational AI models. We talk about ChatGPT and all those things. But those things that is imported. We cannot take that as such because our culture, our wisdom, that is unique for India itself. So in that case, AI is a game changer for Uttarakhand in mental health care governance and service delivery can be humongous. Viksit Uttarakhand and holistic mental health care system in Uttarakhand. Now, I am coming to the point that ma'am has told at the initial phase. By leveraging Sanskrit for AI foundational model R&D for holistic mental health care, Uttarakhand can position itself as a leader in Indic AI research, creating impact in. Actually, I was studying and I got a paper from NASA. They are telling that as because the grammatical aspect, non-ambiguous, Sanskrit language is non-ambiguous, syntax and all those things. Although I don't know anything much about Sanskrit, I studied only in class 6th. But still I remember those things were very clear-cut. And especially, not only the Sanskrit, the language aspect, but the ideas, the wisdom, the perennial wisdom, the Indian wisdom that you can get from the language if we do research in on the basis of Sanskrit, then Uttarakhand can lead this country because Uttarakhand has got a rich culture of this Vedic civilization, of this, Uttarakhand has got this Sanskrit university also in Pauri. So we can use those things for this research, for this cutting edge research. We can make our foundational AI like an Indian because AI is something which captures the essence of the civilization. So we must develop our own foundational AI. I think, thank you very much.